So, when you're looking at recovery and someone's saying, why am I not recovered? The reason you've got to ask yourself is what most people have learned about anxiety and OCD usually isn't very robust. Now, let me highlight that again. What most people have learned about OCD and anxiety usually isn't very robust. And this is something I have to keep repeating and talking to people who work with OCD sufferers all the time about why the recovery journey and the process has to be robust. I'll tell you why. If we just approach things with, these are just OCD thoughts, these are just meaningless thoughts, these are just anxious thoughts, that doesn't do much when we're confronted with difficult life adversity, difficult life struggles. For example, if today I got cancer, hope doesn't happen, but if I did, if I just tried to observe that as a thought, as a feeling, and I just sat and tried to live in the now, that ain't going to work if I'm very, very, very scared of dying and very scared of losing control of my life. As Krishnamurti once said, fear of death is not so much, I'll get the quote completely wrong, but it's not so much about fear of dying, it's a fear of the known coming to an end. So it's the things that we know, the certainty, the clinging on to the known, the life we know, and it's the fear of going into the unknown. So it's more of fear of the known coming to an end rather than the unknown. Then what I often do is when helping people with fear of death, for example, I use the Mark Twain quote, which again I don't use that quote individually to help them with fear of death. I'm talking about the process of that. But it's like we've known all the period before we were born. We've been dead for all the period before we were born. And that didn't bother us one bit. So we view death as this like impending doom that's coming. But we've been dead for all eternity before we were born as well. So it's like both sides. And that helps change the perspective of it. And with fear of death, what I'm doing is helping people philosophically break down why they're so scared of those particular things, which most humans are. Most humans' sort of general being on a day-to-day basis is putting off the idea of death to be acknowledged at another period of time, not in the present now, because most people find that hard to confront and don't want to confront it. And then they have other ideas and things they believe in to help get away from that fear of death. So fear of death is often at the core. Now, back to the point I was saying with the cancer situation. If someone has cancer, you can't tell them, oh, it's just thoughts, just leave the thoughts there, just sit with the sensation. It's going to help a bit, but if they're terrified of death, terrified of losing their life, or all the other core fears that could be attached there, fear of losing their kids, fear of losing their job, fear of losing their family, fear of not having enough money to provide for their family after they die, all these different things, anxiety consumes us and it doesn't back down. And OCD sufferers that have got chronic OCD, they understand that, they realize that, because these life situations happen, these situations occur, and they realize it doesn't back down. I've said for many years, you can't train someone up to help somebody with OCD in a few weeks. You know, it's like you'll see centers for OCD treatment hiring tons and tons of therapists in 1 month, 2 months, and sort of putting them through a fast course. You can't do that, because I used to go to so many people to learn about, to get better from OCD, so many therapists. And in that period, I used to think, well, I know more than they do, because I've been spending years now reading this. So how's someone who's trained in 2 weeks gonna know this more than myself here? I'm not talking about their general knowledge overall in psychology. I'm talking about in relation to OCD. It's not something that you can just do that quickly. There's a lot to it. And that's the same as a lot of books. A lot of books are just repackaged versions of someone else's book. You just take a book on thoughts are thoughts, leaving thoughts there, changing a relationship with thoughts, and then that's just repackaged into 10 books with the same principles and the same, and just a little bit of variation. And the problem with that is you're not getting the depth of knowledge that's usually needed for OCD. To help somebody with OCD, they need to change a lot of their really strong irrational beliefs so that fear really comes down. That's one. They need to have an understanding of OCD to some depth and be able to change their relationship with OCD and learn to not get caught up so much in the mechanism. Then you've got to work on what their particular core fears are and break those down. Not easy to do when you're doing it on your own to yourself, because you can't always see what exactly you're doing in your thinking.